Hi, my name is Hunter Bailey, and today I'm going to be doing the injection site video. Here's my USA College of Nursing ID badge, and here is my patient. So the very first site, what I want to go ahead and locate is the deltoid. So the deltoid is for intramuscular, and it's the smallest intramuscular site. So what I'm going to start by doing is finding the deltoid insertion point, and it's right here. So I'm going to go 3 fingers up, then I'm going to go 3 fingers down from the acromion process, which is the furthest point on the shoulder, and here's my site. And then I'm going to make a little V with my fingers, and I would give this at a 90-degree angle. Okay, the next part is the dorsolateral injection site. So it's going to be likewise, but it's going to be on the lower half of the arm. So again, I'm going to find the deltoid insertion point, which is right here, and I'm going to go 3 fingers down, 3 fingers up from the olecranon process, the elbow, and I would give it on the lateral side of the arm. And this is my site, and this is for subcutaneous injection. So I would either give it at a 45-degree angle or a 90-degree angle, depending on the length and size of the needle and the amount of subcutaneous tissue. Now the forearm. This is an intradermal injection. So I'm going to go 4 fingers down from the antecubital fossa and 4 fingers up from the wrist. And I'm going to make sure to avoid any obvious vessels or ligaments. And this is going to be my insertion site, and it's intradermal, so I'm going to give it at a 15-degree angle, bevel up, so a bevel will, it's not a bevel, it's a bleb, excuse me, I'm sorry, it's a bleb, it's a bubble that looks like a bleb, and it will form. Okay, so there we go. Now I'm going to move on to the abdomen.
That was funny.
Bevel, no. Okay. So now the abdomen. The abdomen is a subcutaneous injection, and it is really good for patients who are getting repeated injections, such as heparin or insulin. And so what I'm going to do is I'm going to stay away 2 inches around the umbilicus. I'm going to stay away. I'm not going to go above the costal margin. I'm not going to go below the pubic area, and I'm going to stay in between the anterior superior iliac spines. There are multiple injection sites where I can give. And this is subcutaneous, so it depends. I can either give it at a 45 or 90-degree angle, and it depends on the length and size of the needle and the amount of subcutaneous tissue. Okay, you can lower your shirt. Now I'm going to do the ventrogluteal. The ventrogluteal is the preferred site for intramuscular injections. Okay, so I'm going to go ahead and pull your pants in just a little bit. Maintain as much privacy as possible as we can. Okay, so it's an intramuscular injection, so what I'm going to start by doing is locating the greater trochanter. Okay, so here we go. Okay, so I'm going to palm the greater trochanter. My thumb is going to go towards the groin area, and my index finger is also going to bend in that direction. And I'm going to make a V with my index finger and my middle finger. I'm going to palpate for good muscle strength. And this is intramuscular, so I'm going to give it at a 90-degree angle. And can you bend just a little bit so they can see? Right here is where I would give it. Okay, you can relax. Okay, pull your pants up a little bit. So now I'm going to move on to the vastus lateralis. And the vastus lateralis is also another intramuscular site. So what I'm going to do is on top of the thigh. So I'm going to start again by locating the greater trochanter. Okay, here it is. I'm going to go a hand's breadth down from the greater trochanter and a hand's breadth above from the knee, this is the top of her knee. Okay, I'm going to make sure to I'm not going to go past the midline of the top of the thigh and the midline of the side of the thigh. And so this is my injection site right here. And this is intramuscular, so I can give it at a 90-degree angle. Okay, and this concludes my injection site video. Thank you.